Breathing is something we cannot afford to take for granted. So, what happens when we can't breathe normally? Then we might need some medications. Let's talk about bronchodilators. Hello, everyone. It's Nurse Mo from Rofem. Let's take a look at this question. A client with acute asthma is experiencing wheezing and shortness of breath. Which medication should the nurse administer first? This is an example of situation where you as the nurse needs to decide which medications to administer. It is super important that you make the right decision and administer the correct medication. Bronchodilators are life-saving medications for people with asthma, COPD, and other respiratory conditions. Whether you are a graduate nurse preparing for the NCLEX or someone caring for yourself or a loved one with a breathing condition, this video comes with knowledge that promotes confidence and will help you to keep your patient safe. When caring for patients with respiratory problems, one of the questions you need to ask yourself frequently is this: can the patient breathe? For graduate nurses preparing for the NCLEX, if you understand how bronchodilators open the airway, which one act fast, and what side effects to watch for, you will answer respiratory medication questions with so much confidence. Medications make the difference between breathing comfortably and landing in the emergency room, especially for people with asthma, chronic obstructive pulmonary disease, or severe allergies. Timing and technique are extremely very important with respiratory medications. The way the medications are used is important just as much as the prescription itself. Bronchodilators are medications that relax smooth muscle in the airways. They can open narrowed bronchi and improve airflow. Bronchodilators are commonly used for asthma, COPD, and acute bronchospasm. Bronchodilators are extremely beneficial for patients with pulmonary problems. Bronchodilators are grouped by how fast they work and how they act. This is very, very important to know for the NCLEX. We have number one, beta-2 agonists. These are available as short-acting and long-acting bronchodilators. Number two, anticholinergics like Spiriva. And number three, methylxanthines like Theophylline. Let's take a look at the short-acting beta-2 agonists. These are first-line treatment for acute symptoms like in asthma attacks. Common examples are albuterol and levobuterol. We need to understand how they work. Short-acting bronchodilators stimulate the beta-2 receptors on the bronchial smooth muscle, and this will lead to relaxation. And they open the airway very, very quickly. This is very, very important. They are used for asthma attacks, sudden shortness of breath, or before exercise if it's prescribed for that purpose. Here is a critical point, and I want you to say this to yourself. Short-acting beta agonists are rescue medications. Common side effects for this group of medications include tachycardia, and that's increased heart rate. They can also cause tremors and nervousness. As for long-acting beta agonists, they are maintenance medications. These medications bind to beta-2 adrenergic receptors in the bronchial smooth muscle over a period of time, and eventually that will lead to lasting smooth muscle relaxation. They are used as asthma controller medications. Examples are salmeterol and formoterol. Here is an important NCLEX rule, and I want you to pay very close attention to this. Long-acting beta-2 agonists are not for acute asthma attacks. They are used for long-term control and prevention of bronchospasms. These medications help to prevent attacks. They cannot stop an asthma attack once they have already started. They are taken on a schedule together with steroids in combination inhalers if they are ordered that way. Now, as nurses, here is where you come in. You need to make sure that you provide instructions to your patients not to confuse their controller medication with their rescue inhaler. They work differently. Controller medications are taken daily as ordered. Rescue medications are only taken for emergencies. The other thing here is we need to make sure we pay attention to side effects because they're equally very important. And that would include irregular heartbeat, tachycardia, which is increased heart rate, tremors, nervousness, and headaches. Now let's talk about anticholinergic bronchodilators. These ones examples are Spiriva and Atrovent. They are also controller medications and they may be inhaled by mouth. They respond much slowly and relax the muscles around the airways to improve breathing. They work by blocking parasympathetic stimulation to reduce bronchoconstriction. Something really important about these medications in this group, just like long-acting beta-2 agonists, cholinergic antagonists, they cannot stop an asthma attack once it has already started, or a bronchospasm after it has already started. Common examples of medications in this group that include Spiriva and Atrovent. These medications are used in patients with COPD and asthma. Sometimes they are combined with albuterol. Now, as nurses, it is very important that we pay very close attention to side effects, and that include dry mouth and blood vision. Encourage your patient when it comes to patient instructions. These are also very, very important. Encourage your patient to drink plenty of fluids if it's not contraindicated for them, because the side effect of this medication is dry mouth. Urinary retention or increased heart rate that does not go away must be reported to the doctor. After using the Atrovent inhaler, it is very important that you talk to your patient to rinse their mouth with water and spit it out to prevent dry mouth. If the medication is an immediate dose inhaler, it is very important to shake it very well before use. Next is Theophylline. This is an older medication. It is given systemically by mouth or by IV. It's still in use though, but it's not very common because of the narrow therapeutic range. Toxicity can happen easily, so you want to make sure you pay very close attention to your patient and their lab result. The therapeutic serum Theophylline is 10 to 20. You want to make sure you pay attention to this as nurses. Theophylline is usually ordered when other medications are not effective. It requires frequent blood level monitoring. And why is that? Because of the risk of toxicity. And you should be familiar with the symptoms of toxicity like nausea, vomiting, irregular heartbeat, or seizures. Now, when it comes to medication interactions, that's also very important. In patients receiving digoxin, theophylline will increase the risk of digoxin toxicity. Here are some nursing priorities for bronchodilators. When giving bronchodilators to your patient, you want to make sure that you always assess their respiratory rate, breath sound, oxygen saturation, and pulse. Education is very, very important. When a client is taking these medications, you need to make sure that you know what to include in the teaching points for those patients. Rescue inhalers, that's for acute symptoms. They should not overuse their short-acting inhalers. If they find in a situation where they have increased need for their rescue medications, then they need to contact their doctors so that they can make changes to their medications. You should demonstrate proper inhaler technique to your patient, and that is to make sure that they know how to use it. Now let's take a look at the practice questions. This is practice question number 1. This is actually the question that we started with. A client with acute asthma is experiencing wheezing and shortness of breath. Which medication should the nurse administer first? A. Flonase, B. Salmeterol, C. Albuterol, D. Prednisone. Which one will you pick as your answer? The correct answer is C, albuterol. Albuterol is a short-acting beta-2 agonist and is the first-line rescue medication for acute bronchospasm. It works quickly to open the airway. Long-acting beta-agonists and inhaled steroids, those are for maintenance, not emergencies. This is practice question 2. Which assessment finding indicate that a bronchodilator is having the intended effect? A. Decreased heart rate. B. Reduced wheezing. C. Increased blood pressure. D. Drowsiness. Which one do you think is the correct answer? The correct answer is B. Reduced wheezing. Bronchodilators are used to relax bronchial smooth muscle, and that will lead to improved airflow and decreased wheezing. The other answers are not correct. Thanks for watching and learning from this video. If you want a more NGN-focused NCLEX prep, we do free NGN workshops regularly. It's live online via Zoom. Our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that's built specifically for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like, share, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.